How can you ensure quick and clear handovers, in person or over the phone? Hello and welcome to this week's Urgent Bite, brought to you by the Royal New Zealand College of Urgent Care. My name is Guy Melrose, and today we look at a simple way we can order our verbal referrals and handovers to other healthcare professionals. In urgent care, we see the full spectrum of ages and conditions, and as a result we interact with the entire medical community. Whether referring a patient, phoning for advice, or handing over to a paramedic, we need to clearly, and more often than not succinctly, deliver information to enable the person on the other end to understand all the important points and be able to advise us accordingly. In the heat of the moment, when dealing with a very sick patient, it is possible to get flustered. Or the person you're talking to might be stressed, busy, have a line of people trying to get their attention, or they might be in a noisy emergency department. There is potential for things to be misheard, or if we ramble, they might lose track of what we are saying. So using a framework to base your handovers around is one way to ensure clarity of information. One such framework goes by the acronym ISBAR, and it is taught here in medical schools, and it's used by paramedics, so if you're not familiar with it, it's worth a look. ISBAR stands for Identify, Situation, Background, Assessment and Recommendation. Identify. This means who you are and what you do. Situation. This is a brief outline of the current situation of the patient. Background. This is a chance to expand a little on the relevant background of the patient and the situation. Assessment. This is what you think is going on, your impression. Recommendation. This is what you'd like to result from this conversation. So an example might be, "Hello, my name is Dr. Kildare and I'm an urgent care physician at the Awesome Clinic in Auckland. I'm with Sarah, who's a 26-year-old woman who has presented with acute abdominal pain, which I think might be appendicitis. She has had 24 hours of abdominal pain and nausea. She's otherwise a healthy person with no surgical history. She's got guarding and rebound tenderness in her right iliac fossa, a temperature of 38.2, a normal urine dip, and a negative HCG. I'm concerned she has appendicitis, and I'd like her to have a surgical review, please." So in some instances, this will be all you need to say, but if asking for management advice about more complicated patients, the conversation might then get into more depth, but by starting out with this framework, you let the person at the end of the phone know the state of play early. This helps speed up the conversation and avoids misinterpretation. Now, whether you use ISBAR or another type of framework, it's often a good idea to write a little script when making a call, particularly when you're a more junior clinician. Taking a few moments to gather your thoughts will pay dividends with a nice, clear conversation. I've attached a link to an open access paper from the Postgraduate Medical Journal from 2011 that looks at ISBAR as a handover tool for junior doctors in Australian hospitals. They found it improved the doctors' perceptions of handover. It's worth a read, it outlines ISBAR very well, and it links to other studies that have shown the effectiveness of this tool. Now we'll be back next week with episode 9. We're changing the format a little bit. It will be split in two, with the specialist interview in a standalone podcast and the discussion and review of the news and other features in a second podcast. This is designed to make the content a little more digestible. I look forward to seeing you all then, but for now, thanks for listening.